So bunion is curving of the big toe, where the big toe starts to fade in a little bit and you have a bump on the inside of your foot. And that can cause problems with shoe wear. It can be painful just in and of itself, even without shoe wear. It can just hurt because the joint's out of alignment. It'd be like a tire that's out of alignment and wobbles on you whenever you walk, and it can just create pain. The etiology or the reasons for a bunion are not exactly defined real well, but it appears that they can come about from tight shoe wear. Women tend to have bunions more often than men because shoe wear often has a more narrow toe box in women than men. It also runs in families. If your mother or grandmother had a bunion, there's a good chance you can end up with a bunion. It certainly runs in families as well. A bunion often looks like swelling on the inside of your foot. It's actually not. It's where the bone starts to fade out, and so you get a little instability in your foot. The ligaments and the tendons start to stretch out and the bone starts to curve out. So many times patients come to me and say, "Can you just take the bump off?" And it's just more complicated than that. I wish it weren't, but it's more complicated than that, and that never works, is just taking the bump off, because it's a ligament and tendon and bone issue, not just a swelling bump issue. And I try to show the x-rays and explain that and show patients what we need to do to correct a bunion deformity. So we diagnose bunions radiographically and with clinical exam, and there are many varieties of bunions. A bunion's never just a bunion. There are many different varieties, and that is how we need to treat your particular bunion depends on the x-rays, and it depends on the exam. Bunions are usually a progressive deformity. I see patients on both sides of the spectrum where they'll come to me and they have a very mild bunion and ask me to fix their bunion so it doesn't get worse. And they're having no pain and no issues with shoe wear, and they just say, it could get worse, I've heard, will you fix it? And then normally I try to talk patients out of that if we can just give them some padding, if they're really not hurting, if it's really not causing any problems, because they don't always progress. They may just be there. So if you have a mild bunion and it doesn't hurt you and you're able to fit into shoe wear that you're interested in, then I would encourage us to try conservative treatment first. Then there's the other side, folks who have waited a long time before they come to see me, and my options become more limited. There are always options to correct a bunion. There's a lot of different ways to fix a bunion, and I utilize all of those. But the further it progresses, the fewer options there are, and we start to narrow to only having a few things that we're able to do to correct that bunion. So seeing patients early allows us to approach the bunion in different ways. If you have a bunion on one foot, especially if it runs in the family, it's often on the other side. That being said, bunions often are traumatic as well. Patients play soccer or they stub their toe and they rip a capsule or a ligament. That can often just be one-sided, because a bunion that starts from a trauma is very different than one that comes from family history or genetics.